This is Dr. Daniel Paul with Easy Orthopedics, and today I'm going to talk about whether peroneal tendonitis goes away. So the first thing, what are the peroneal tendons? So the peroneal tendons come from these two muscles, the peroneus longus, peroneus brevis, and it comes down kind of the outside of your leg and attaches to your foot at various points. And what those muscles do is they allow your foot to kind of swing to the outside. So it's something that we use all the time when we're walking or kind of doing most activities. Now with some people, those tendons, like any other tendon, can get really inflamed and start to cause pain. And generally what somebody feels is pain kind of on the outside of their ankle when they walk or when they move their foot to the outside. It's fairly common. Those who have high arches are more likely to get it. So sometimes people can get this tendonitis in this area and it becomes nagging and they're wondering whether it will ever go away. So the short answer is yes, it can definitely go away, but only if you take care of it properly. It depends on how bad the tendonitis is. If it's not too bad, then just some icing and anti-inflammatories and some activity modification is usually enough to kind of get it better. If that doesn't work, kind of like most injuries in the foot, a lot of times what we just do is put someone into a boot or some sort of special shoe, and sometimes that alters the biomechanics and sometimes helps everything calm down. So sometimes what I'll do is someone has peroneal tendonitis and it's been bothering them enough to see me, I usually put them in a boot for a little bit of time. And then afterwards, we'll work on some physical therapy and some other exercises to get them better. Usually that does pretty well, and most people get better from that. Now also what's important is activity modification. So if there's certain activities that you're doing that bother it, then those are ones you kind of want to ease off of, at least for a while until it feels better. What I tell people is, I know it hurts now, but if you stop doing these activities, it's worse actually with weightlifters, they never want to stop. The goal is to get you back to where you were before. And by calming down for a little bit, you'll be able to do that. But if you don't, then it's just you have this nagging injury. So if those sorts of things don't work, some people will do steroid injections. I don't really do that. It's questionable. Sometimes people believe it leads to tendon rupture, so they're not commonly done in that area. And also, if you're having pain after a trial of a boot and physical therapy, then there may be something going on a little more than tendonitis. Two things that can go on is one, peroneal tendon tear, so that could be tear of the peroneus longus or brevis. Or two, sometimes the tendons end up snapping around the outside of your ankle. They're held in place by something called the superior retinaculum. When that tears, people can actually have these tendons kind of moving around the outside of their ankle, and it can be painful. If you have a tendon tear or tendon snapping, then you can try conservative management with a boot and physical therapy, but more than likely if it's been bothering you, you may end up needing surgery. And the way to tell if you have that really is MRI is a good bet. You can get x-rays, and if there's sometimes that'll show like a fleck of bone if the tendon's pulled when they tore a piece of bone off. But that's pretty rare. Most of the time an MRI will tell you everything you need. Or if you have a provider who uses an ultrasound, which I use, you can also look at these tendons in real time and see and evaluate them. So those are two options there. But like I said, if your tendons are torn, you may need surgery to repair them. Or if they're snapping and the superior retinaculum tears, you probably need someone to repair that as well. So that's kind of the nuts and bolts of peroneal tendonitis. You can get rid of it one way or another. Most people, it's just inflammation and some rest, ice and activity modification, and a boot and some physical therapy does the trick. If not, then you're probably looking at more of a peroneal tendon tear or possibly snapping of the tendons, or we call subluxation. I hope I was able to answer your questions. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. We're putting out new content every week, so please subscribe and hit that like button, and thanks for watching.